we're going to follow the pathway of blood for the arteries as it's leaving the left ventricle of the heart and pumping out to the rest of the body. Okay, so this side of the board shows what the anterior blood flow looks like. If we have the arteries, all of this blood, oxygenated blood, is going out to the body via the arch of the aorta. Okay, so what we find is that there are two visible branches from the arch of the aorta. There's one branch that we can't really see that serves all of the coronary arteries on the heart. And so we identify, because we can't see that branch, we identify the coronary arteries on the surface of the heart. So this one here, you can see some pink. So the pink is your coronary arteries. This one has a few little weak ones here. All right, so we have our first branch, which is feeding the coronary arteries, but our first visible branch is this big brachiocephalic branch here. So that branches off into three different main tributaries, and then we have the second visible branch that mirrors one of the right branches that goes off into the arm. So the arch of the aorta turns down along the dorsal body wall, the medial dorsal body wall. And before it hits the plane of the diaphragm here, the arch of the aorta is called the thoracic aorta. And all of the tributaries coming off of this thoracic aorta are feeding all of the rib muscles or the intercostal muscles. And these are called the intercostal arteries. So once we hit the plane of the diaphragm, we move to the posterior of the body, and our main dorsal aorta becomes the abdominal aorta. So once we hit the plane of the diaphragm, we have the abdominal aorta. The first tributary off of that feeds the anterior digestive tract. It's called the celiac trunk artery. The next branch is the superior mesenteric artery. The branch following that is a paired branch called the adrenolumbar artery, and it feeds the area where the adrenal glands and the upper lumbar vertebral column is. Then we have another pair of arteries, the renal arteries. We have another pair of arteries, which are either the testicular or ovarian arteries. We have a single artery going to the colon. This is called the inferior or posterior mesenteric artery. Then we have another pair called the iliolumbar arteries. And then we have a nice branch into both legs. In the plane of the abdomen, the right and left branches are called the external iliac arteries. There is a branch that comes off the external iliacs that goes medial into the sacral region of the cat. These are the internal iliac arteries. And once this external iliac passes the plane of the abdomen onto the leg, it becomes the femoral or femoral artery. Okay? So that's blood coming from the heart going to the rest of the body. So when we talk about vein flow, we're talking about bringing deoxygenated blood back to the heart. So if we work from the tail back to the right atrium and then the head region back to the right atrium, we'll get our venous flow into the right atrium of the heart. So what's cool about the veins is that they often mirror the pathways of the arteries. So we're looking for blue versus pink usually. Veins are in blue. I forgot the artery going to the tail. This is the caudal artery. It has a mirror caudal vein that's coming from the tail. Coming from each of the legs, we have a femoral vein. Once the femoral vein hits the plane of the abdomen from the leg, we have the common iliac vein. Okay, so those mirror our external iliac arteries. Those all join in to this main vein right here, which is called the post cava or inferior vena cava, posterior vena cava, I don't know, it's got like a million names, okay? There's a pair of veins that joins in, the iliolumbar veins. Then we have the testicular or ovarian veins that usually in mammals join into the renal vein before dumping their contents into the post cava. So far, when I've opened any of these bunnies, all of the testicular and ovarian veins are connecting into the post cava instead. So your job is to identify what sex the bunny is, and then if I'm pointing to a blue or a pink that's going out toward those gonads, you say artery or vein. Okay? It's also going to be important that you know the difference between left and right. So remember, when you're determining left or right for an anatomical exam, it's the patient's left or right. Okay, so this is left, this is right. All right, traveling up north, we have our renal veins coming from the kidneys, the adrenolumbar veins coming from the adrenal gland areas. These all dump into our post cava, and eventually the post cava around the area of the liver joins in with that big yellow hepatic portal vein. Okay, and once that blood supply goes through the liver, it reemerges on the other side of the liver, the anterior side of the liver, as the post cava, and then dumps into the right atrium. Okay, if we're draining the head, what we have here are anterior and posterior facial veins that we're going to find at the anterior ventral portion of the masseter muscle. So the masseter muscle is going to give us a clue to where a lot of these upper vessels are. So we just have to look for that masseter muscle. So the anterior and posterior facial veins are going to drain into this big external jugular vein. The external jugular vein will run along the outside of the neck and then into the body cavity at the pectoantebrachialis muscle. So there's like a little division between the pectoantebrachialis and your clavodeltoid muscle where the external jugular enters the body. Once it enters the body, a very small and sometimes not very well injected internal jugular vein enters or dumps into the external jugular. The subclavian vein coming from one of the arms will join in with the external jugular, and once these two join together, this big vein here becomes the brachiocephalic vein. Okay? A vertebral vein will join the brachiocephalic vein on each side, and once the vertebral veins join in, the little vessel that's leading to the right atrium is the precava or superior vena cava. Okay, and then there's a special singular vein that runs anterior only on the right side of the back of the heart. So you have to pull all the organs off to the bunny's left side. And you'll see the singular vein here that joins into the precava. This is called the azygous vein. Azygous means without a twin. And it's also draining those intercostal or rib muscles. And these are the intercostal veins that are draining into the azygous vein, that are draining into the precava, that's also receiving blood from the right and left brachiocephalic trunks, which are receiving blood from the jugulars and the subclavians. All right, let's look at it on this cat. Bunny. All right. So we're gonna put this one off to the side because my bunny has some kind of good vessels. So there's a little bit of an incident with the latex here, it looks like. But anyway, so like here's our heart, right? And we can see the right atrium and the left atrium, and we can see this division here that splits the right ventricle from the left ventricle. So if we cut it like last time, ooh, squishy. I'm hungry. so look at here. Look how thin the walls of the right atrium or right ventricle are. So this is all dried up blood and latex. Okay, so look at how thin that is compared to our left ventricle. Look at how muscular this is compared to, look at the walls of that. Okay, remember the right ventricle is only pumping blood to our lungs. The left ventricle is pumping blood all the way around this bunny. Okay, so remember our first tributary off the arch of the aorta is not visible, but we can see the coronary arteries on the surface of the heart. Our first visible branch, though, is this big branch right here. And the first two tributaries off of there are your common carotid arteries. Okay, so the common carotids are going to follow just lateral to the trachea. So you'll be able to see them. What you want to do is take one of these carotid arteries, common carotid arteries, and follow it up to where your masseter muscle is. Okay, so because the latex injection looks like it got a little out of control on the right side, I'm going to follow this left common carotid artery way up here to where the masseter muscle is, and I'm going to kind of peel away toward, I'm just going to bend this artery this way. And what I see is that there is a branch of this artery that's going deep and medial. So you see this pinky right here? This is the internal carotid artery, and the external carotid artery continues up into the anterior of the face. Okay, so my internal carotid artery is not that great. I couldn't even find it on this one. So don't break it if you use my bunny. See that it's broken here on this side, way down here. And then, you know, it's just fucked up here. So let's not, we'll just go with mine. All right, so internal carotid, external carotid. Okay, so those are the first two branches off the brachiocephalic trunk artery. The next branch, see this branch right here? It goes all the way off into the arm. Okay, there's one over here. This one goes all the way off into the arm here. This is a nice bunny for that. Okay, this is, okay, so after our common carotids branch up toward the head, then we have the right subclavian artery branching into the arm. So you're going to have to look for 3 branches from the right subclavian artery. There's a branch that's coming off anterior toward the head, and then 2 branches that are coming off posterior toward the heart. So here, this anterior branch, this is very nice. Andrew's bunny. Sorry. So this branch, look at it, it's going off toward the inside of the neck, kind of the lateral side of the inside of the neck. This is called the costocervical trunk artery. So it's going up to those cervical vertebrae. Can you see that? All right. Right there. Andrea. See this one right here. Okay. And then look, guys. Here are the 2 posterior tributaries that are branching off right around the same area as that costocervical trunk artery. Okay, so these 2, if I follow this one, it goes toward the medial area behind the heart. It's going toward the spine. This is the vertebral artery. This one, look at it, goes all the way out to the chest wall here. This is the internal mammary artery. Okay, so it's serving all the mammary gland areas. Okay, so with our first branch off the arch of the aorta, we have the brachiocephalic trunk artery. It branches off into your common carotid arteries, which split into an internal and external carotid artery up near the masseter muscle. Another branch off of this brachiocephalic trunk artery is the right subclavian artery. The right subclavian artery has an anterior branch, the costocervical trunk artery, and then it has a vertebral artery branching posteriorly, and an internal mammary artery branching posterior laterally. Okay, so the next branch off the arch of the aorta is the left subclavian artery. So the left subclavian artery has its own branch off the arch of the aorta, and it will have the same tributaries as our right subclavian artery. So we have our costocervical trunk, thank you, and then we should have a vertebral, I can't see it in this one, and an internal mammary artery, right? But look at this internal mammary artery is branching off the arch of the aorta at its own place. That is an anomaly. That's not right. But let's look at my bunny, because my bunny is perfect. Not really. Okay, so here is my left subclavian artery. Okay, I have this lovely branch into the arm, that's the left subclavian artery. I have my costocervical trunk artery. Here's my internal mammary artery, and very much posterior medially is this vertebral artery. Okay, so that's the anterior arteries. So let's peel the heart and shit over to one side, and we can see that the arch of the aorta makes a turn posterior along the vertebral column. Okay, so here's my diaphragm right here. So it looks like the diaphragm's right about here, cutting the body into thoracic and abdominal cavities. The aorta above the plane of the diaphragm is called the thoracic aorta. And all of these little pink tributaries that are going into the rib muscles here, those are the intercostal arteries. Yeah. And so now the thoracic aorta, once it crosses the plane of the diaphragm, becomes the abdominal aorta. Okay, so here's our big abdominal aorta. And the very first branch off the abdominal aorta is just posterior to the diaphragm. And that branch is called the celiac trunk artery. So I busted up all of my connections on this one. Ooh, look at that. It's beautiful. All right, so this first branch right here, the celiac trunk artery, has two anterior branches coming off, going toward the thoracic region, and then it's got one posterior branch that eventually splits off into two. So this first branch here, where is it? Oh, I fucked it up. Okay. Oh, it's missing right here. So see this branch right here? We'll just use this small one. Okay, that branch right there is going to go to the liver. This is the hepatic artery. And then the second one right here is going to go to this big old stomach right here. This is the left gastric artery. There's no right gastric artery. There's a left gastric and a gastric. Okay, so hepatic, left gastric are the anterior branches from the celiac trunk. The posterior branch is this one right here. This is the gastrosplenic artery. And when it makes its way toward the stomach here, you can see, kinda, that it splits. Mine's better. You can see that it splits here between, no it's not. Oh, there it is. Okay, I got it. It travels way up here, so here's my gastrospleen. Oh, that's where it's messed up. Okay, there's the gastrosplenic artery. And as it makes its way toward the greater curvature of the stomach here, you can see one of the branches splits to the stomach and one goes to the spleen here. So here's the gastric artery and the splenic artery. Okay, so your posterior branch right here off the celiac trunk artery is this gastrosplenic artery, it splits into a gastric branch and a splenic branch. Your anterior tributaries from the celiac trunk artery, one goes to the liver, that's the hepatic artery, and then you have this one here going to the stomach, that's the left gastric artery. Okay, as we make our way down this abdominal aorta, we'll see that there's another branch. It's a pretty big branch that's going toward these anterior intestines. This is the superior mesenteric artery. Both the celiac trunk and the superior mesenteric artery are not paired. There's only one. That's also true for this little artery right here that's going toward right to the colon. This is the inferior or posterior mesenteric artery. There's only one of those. The rest of them, most of the rest of them have pairs. So the next tributary comes off here. It's kind of a mess, but it looks like the two are joined, and I think it is anomalous. But usually this little artery here that's running toward the top of the kidney, the anterior portion of the kidney, when you dissect out your bunny, you'll notice that there's usually a glob of fat right here. That glob of fat contains the adrenal gland. So this artery here is feeding the anterior lumbar portion of the spine and the adrenal gland. It's called the adrenolumbar artery. So there's one on this side, and then there's one on this side too. So it's kind of hidden by the kidney, but this is it right here. Okay, so the next artery is this big one going to the kidney. This is the renal artery, and then there's one on the other side too, I promise. Okay, so next, what we're looking for is our inferior posterior mesenteric artery, but it looks like right here that my testicular arteries, this is a boy, are branching off in a couple of different places. So usually they branch off pretty symmetrically, and they branch off anterior to the inferior mesenteric artery. This one, the right testicular artery here, is branching off anterior to this posterior mesenteric artery, so it's way up here. And then this testicular artery that we dug out last time, a yank on it, we'll be able to see, oh shit, there it is, poor little testis. Okay, it continues out to here, but this, see this artery and vein pair right here? The artery is branching off the thoracic aorta posterior to my inferior mesenteric artery. Okay, so that's kind of an anomalous split because they usually split off pretty symmetrically. Okay, so now what we're going to see is that this thoracic aorta forms a V as it brings blood to both legs. Okay, so there's this big V here. All right. And before the V continues posteriorly, there's a little branch, little artery going off to the lower lumbar spine. Okay, so you can see one right here and kind of see one on this side. This is the iliolumbar artery. Okay, ilio referring to where the ilium or the iliac crest is of the hip. So our big V's here that are bringing blood to the legs are our left and right external iliac arteries. Okay, so the external iliac arteries actually continue out onto the leg right here. So see, we have our sartorius muscle here, and we see this plexus of an artery and vein leaving the plane of the abdomen. This is a continuation of the external iliac artery. Once it leaves the abdomen and goes onto the leg, we call it the femoral artery or femoral artery. Okay, so our V here of external iliac arteries, another tributary runs medially. It's a small tributary. It's on this side here. Dig it up somewhere. looks, there we go. So I have my two internal iliac arteries, and then straight down the center, see this pink thing right here, straight down the center is the caudal artery bringing blood to the tail. Okay, so that's what we have in the posterior region. So we have the celiac trunk artery, which branches into the hepatic, left gastric, gastrosplenic, and then gastric and splenic. And then we have the superior mesenteric artery, adrenolumbar artery, renal artery, testicular or ovarian arteries, inferior mesenteric artery, iliolumbar arteries, external iliac arteries, internal iliac arteries, caudal artery, femoral artery. All right?
Can you show again the renal artery?
Renal? Look at this big bad boy here. See? It's huge. So what's cool about the veins is they're usually accompanied by the arteries. So you know your veins, you should know your arteries. So we're going to start in the posterior region here on the outside of the leg. So this femoral vein here, the blue, is draining blood from the foot. This is a left femoral vein. Once it enters the abdominal cavity here, oh, this is the really shitty one. Let's see about this one. Ooh, that's nice. Okay, so look at it. Once it enters the abdominal cavity, we have a V, just like with our external iliac arteries. We have common iliac veins. Okay, so this is a really nice example. Common iliac veins. And if you look way in the center there, you can see both a caudal artery and a caudal vein, yellow or pink and blue. All right, so these blues right here are your iliolumbar veins. Okay, as we march further up, it's not colored here. It's not injected with latex, but you can see it's dark color, purple-ish. That's the testicular vein of this guy. And it looks like it's joining in, if it's still injected. Yeah, it's joining into the post cava right here, or posterior vena cava, inferior vena cava. So here's the other one. It's also not injected, but mine. Okay, so here's a testicular vein and a testicular artery. Iliolumbar vein on this side. I can't see it on this side. Here's another testicular artery and testicular vein. Okay, so all of those, your common iliacs, your caudal, iliolumbar, and testicular, are all going to join into this big blue vein here, which is the post cava. Okay, so the post cava continues up and is joined by this big renal vein. Look at that big blue, big renal vein. It's also joined by, just pretend it goes there, the adrenolumbar vein. Oh, this one's not injected. Look at renal, and you can see a little bit of the adrenolumbar. Okay. All of those join into this blue post cava. And look, see, we're starting to get into the liver here. And joining in with that post cava is this giant yellow hepatic portal vein. Okay, so here in the middle, they come together and enter the liver. Right here, can you see blue and yellow stripe? Okay. And the blood is processed in the liver, and then it comes out this side in your falciform ligament as the post cava. Okay, the post cava then continues up to our right atrium. All right, so that's from the posterior. We have femoral to common iliac joining in with the caudal vein. Joining in are the iliolumbar veins and the testicular or ovarian veins into the post cava. Joining in are the renal vein and the adrenolumbar vein. Those all join into the post cava, which joins with the hepatic portal vein, and the post cava then brings all of that posterior blood to the right atrium of the heart. Now, this poor kitty bunny doesn't have very well injected anterior veins, and mine are kind of explodey, but they're visible enough. Okay, so what you're going to look for when we're draining the blood from the head is we're going to look for that magic masseter muscle. Okay, and you're going to look for where those sublingual glands that we dug out were. So remember, the anterior of the masseter muscle, like along the what's that called? The muscle, mylohyoid. Along the mylohyoid is where your external carotid arteries are, but it's also where your anterior and posterior facial veins split. Okay, so you can see one big vein coming from the medial side and one coming from the lateral side. This is the anterior facial vein and the posterior facial vein. They join together into this big external jugular vein here. Okay, so if you recall, this one's a little better. If you recall, this external jugular vein runs along the surface of the neck muscles and then enters the body right here at the pectoantebrachialis and clavodeltoid area. Okay, so see, look at that big jugular vein. It's crazy. Okay, so right there at the pectoantebrachialis muscle, this big external jugular vein enters the body cavity. Okay, it travels down toward the heart on both sides, and then it's joined by a tiny tributary. Okay, did not exist on mine. Let's see if I can point it out, even though it's not injected. Well, it's kind of a failure here too. Okay, so what happens is from this internal region, the internal jugular joins in with the external jugular, and often the internal jugular is not injected well, so we do get to see it. Somebody had a really good one, but here this looks like part of one, but it joins with the external jugular when it's inside the pharyngeal area here. Okay, so you get an internal jugular and it would follow this common carotid artery. Okay, so internal jugular vein joins in here with the external jugular, and then coming from the arm we have this big branch here. This is our subclavian vein. Okay, left subclavian, right subclavian, joining in with the subclavian vein and the external jugular. When those two join together, the big branch leading to the right atrium is called the brachiocephalic vein, left and right. Joining in with the brachiocephalic vein is this vein coming from the outside chest wall. This is the internal mammary vein. Okay, on this side, let's see, no, that's subclavian, and it looks like it's broken right here. See the blue? Okay, so that's internal mammary vein. And then if you look medially along this brachiocephalic vein, you're going to find a vertebral vein that's coming from the vertebral column. Okay, on there, it's on that side. Look at it on this side, it's really pretty. Okay, so see, here we have our external jugular and the right subclavian joining together. These, when they join together, this is called the brachiocephalic vein. The brachiocephalic vein has a tributary coming from the chest wall that's called the internal mammary vein. Coming from deep in the vertebral column is the vertebral vein. if we sweep all of the heart and lungs to the left side, we can see along the dorsal body wall this rogue vein right here. Okay, this vein is the azygous vein. Azygous means without a twin. And once the azygous vein joins in here, it's joining into the precava or superior vena cava. So the brachiocephalic vein becomes the precava after the internal mammary vein and the vertebral vein join in with the brachiocephalic. Okay, so this azygous vein is also draining all of these intercostal veins here, bringing blood back to the precava and from the precava into the right atrium. Okay, that's it.